So without further ado, I'm going to turn it over to Brian Wright.
I appreciate the introduction. Thanks for coming, guys, into Align. I really appreciate you guys coming out, you flying in. Thanks a lot. It means a lot. So three things. Three things you guys in this room. Look to your left, look to your right, and all the people around you. Three things that you know in your heart of hearts that you are doing that nobody else is. Commercially. Clinically, it doesn't count tonight. Commercially. That nobody else would think of, no one else is doing in healthcare. And think of that for a second in your head. What do you know that you do that nobody else in this room or healthcare period is doing to grow your business? Whether that be from your patient experience standpoint, how you answer the phones, how you communicate every morning, your morning meeting, whatever it may be from a commercial standpoint. And 90% of a practice is commercial. And we're going to get into a lot of that tonight. And it's not to diminish the clinical importance of anybody in this room, because great admiration for the expertise that all of you have. But if you start looking at the hundreds of operations that go on daily inside your business, it's all commercial. And that's what we want to focus on tonight, 8 strategies that will allow you to separate yourself that nobody else in healthcare is doing. We look at things very differently than anybody else in the industry. We're going to get into that tonight. But I really, just for a second, want to again pause and ask you 3 things. Because if you can't definitively say 3 things in your mind that you are doing that nobody else in this room is doing, you are losing money, and you lost opportunities that you may never know about every day, week, month, and year. And you need to constantly ask yourself that, because it leads us into our very first one. We're going to start off with a strategy number 1 here and jump right into it. And that is acting like a high-level CEO first, an innovator first, and acting like some of the most best entrepreneurs on the planet. And doing that first, and being a doctor second. And again, not to diminish the clinical importance, but the facts are every one of you own a business. You have people to lead, people to train, people to motivate, just like every other business on the planet. And when you act like a high-level CEO, some of the best, Steve Jobs, there's a lot of them out there. It doesn't matter if they're in healthcare or they're in the commercial environment. When you act like a high-level CEO first, you become an innovator. And that's what you do to separate yourself from everybody else. Do it differently. Healthcare has always been a place where you want to know what the guy down the street's doing. Boy, that guy's running a great practice. What is he doing? What we want you to do is think differently than the guy down the street. Be an innovator. Do it your way. But do it your way that's completely different than anybody else. And when you do that, your practice will grow like you never even dreamed.